Now with a closer look at one of the most dangerous yet underreported aspects of this pandemic, the rapid spread of COVID-19 in prisons. This New York Times headline captures the dilemma: jails are petri dishes. Some states have taken steps on their own to mitigate the risks. Late Friday, Attorney General Barr called for the transfer of inmates most vulnerable to home confinement, beginning with federal facilities in Ohio, Connecticut, and Louisiana, where 5 inmates have already died from the virus. And now there are new cries for help from one of the nation's most overcrowded state prison systems. ABC News has obtained an exclusive video from inside the Alabama prisons. Take a look.
It's going to be a mass grave site up in these prisons.
This is a dormitory. We stupid crowded, we super crowded. Now, as you see, the folk walking down the aisle, and they got to turn it. See, that aisle is too small. It is way, way too small. These are the beds. They right beside each other, and this is the space. Stretch your arms out again. That's how close we are. See, these are the people that they should be letting go due to the coronavirus. What in the world can this man do?
The sinks are very outdated. We cannot wash our hands simultaneously at the same time. You know, my thing to the outside world is help. Help. Help for the overcrowding, help for sanitary purposes, help for a release mechanism. We need to release some of these people. We need help.
Dramatic video there. We reached out to the Alabama Department of Corrections. They acknowledged that current conditions mean they can't enforce social distancing, adding that the department is working to do everything in our power to mitigate the spread of the virus. As of Friday, no Alabama prisoner had tested positive. A couple of prison workers have confirmed positive. And we're joined now by Dr. Homer Venters, president of Community-Oriented Correctional Health Services, former chief medical officer for the New York City jail system. Topeka Sam, a former inmate who spent 3 years in prison for a nonviolent drug offense, now a criminal justice reform advocate, co-founder of New Yorkers United for Justice. And Bristol County Sheriff Thomas Hodgson. He oversees 5 facilities in Bristol County, Massachusetts. Thank you all for joining us this morning. And Dr. Venters, let me just begin with you. Just give us a sense of the scope of this public health crisis in Americans' prisons right now.
Sure, and good morning. We have 5,000 county jails and state and federal prisons, and probably another 2,000 juvenile detention centers and ICE detention centers. These places are almost perfectly designed and run in a way to promote the spread of this virus throughout these institutions, affecting not only the people who are held there, but the staff. We saw it in New York City. In just a couple of weeks, we went from 2 cases to 38 cases to now over 500 cases, split evenly between staff and detained people. And so the danger here is that we're not only really going to see the explosion of cases among people who are detained and the people who work there. This is going to drive the entire epidemic curve for this nation up just when we're trying to flatten it.
And Topeka Sam, you've lived inside some of those facilities. Give us a sense of how difficult it is, we saw some of it in that video right there, to accomplish social distancing inside these prisons.
Absolutely, George. There is no such thing as social distancing inside of prisons. As you saw, the conditions are no different than when I was incarcerated in 5 different prisons around this country, in federal prison and county jails. That video is heartbreaking. You said it best first, that this is a public health issue. Mass incarceration is a public health issue. And now that this outbreak has happened, I'm happy that we're taking a look at prisons in a different way and the people that are actually in them. Unfortunately, as you see, there's no way to properly be 6 feet apart. There's no way to properly wash your hands. There's not enough soap. They can't use hand sanitizer because of alcohol products that are in them, and they're considered contraband. You have people, that was an open dorm. But where I was, there was cells. And in those cells, we were locked in sometimes up to 21 hours a day. I just received a call from Michelle West, who's in federal prison. And she actually is in Dublin, California, where they're locking the women in for 5 days out of 7 days. So they're only allowed out of their cell for 2 days a week, Tuesdays and Fridays, for 15 minutes a day to take showers, make phone calls, or just get some fresh air. This has to stop. We have to begin to release our people from prison, because not only is it the incarcerated population that's impacted, it's the officers, it's the chaplains, it's the workers who come home back into the community and then spread the disease even further within our community into their own children.
And Sheriff Hodgson, though, the question is, how do you balance those very real public health and safety concerns against the safety risks of releasing too many prisoners?
Well, good morning, George. That's a great point. Look, it's all about your protocols in the prisons and how well your staff are prepared. We've been dealing with H1N1 prior to this, SARS, all of those viruses. It's all about the control you have in your prisons. Now, if you let people out into the streets, 80% of our population have drug-related issues. They have compromised immune systems. So you let them out into the community, they're a higher risk, become carriers. They're going to start feeding their addiction. They have no support to get medications. They're going to have no rehabilitative programs out there. And they're going to be wandering into stores, under the influence of drugs, not to mention the fact that when they overdose, if some of them do, you have the emergency medical people having to respond. And then we've been worried about ingesting a particle of fentanyl, never mind the exposure to COVID-19, which will happen. The other thing is these people have nowhere to go. Many of them are going to go stay in apartments with 3, 4, sometimes 5 families in a 5-room apartment. I can't think of anything more dangerous. If we're talking about distancing, I can't think of anything that would be more distancing than have the prisoners in the jails protecting the people on the outside from adding more carriers and more exposure. We have the protocols in place. We have no COVID-19 people. We've been at this for a month. Most of the prisons, I think, except for one facility in the state and Middlesex County had 2 prisoners. Other than that, there are no prisoners, as far as we know, in our county systems.
This is such a difficult dilemma. I wish we had more time to look at it today. We will definitely revisit it, but thank you all for your time this morning.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.